I went on your website and I see a lot of information that I think will be valuable to the public. So before we get into your healing method, I would like to touch a bit on those that I've seen. And the first thing I would like to speak about is costochondritis.
Yeah.
Can you tell us what is costochondritis?
Nobody seems to be looking at the whole of the body, the condition of the whole of the body. I mean, there's lots of research that's going in for brain scans and blood tests and things, but examining the physical condition, for instance, a whiplash injury to the neck, a jerk forward, you've got micro tears in your neck. I spend a lot of time in a swimming pool using floats. I've got a good swimming pool I go to. It's not deep, so you can walk in it. I can use the floats to feel the balance in my arms, to try and let the rest of my body just relax, gives me the freedom to move. And if the medical profession don't believe you, or you start to think, how can I have all these symptoms and syndromes? I mean, so many muscle syndromes that go wrong. I'm thinking, I've got all of them. And I'm thinking, how can I have all of them? But I did, because my physical condition was that bad.
But what if they say that the pain is so intense, you don't have any motivation to do anything? Hi. YouTube have two ways to push your channel. With that said, I'm asking you two quick favors. If you like what I'm doing and want to support my growth, please give me a thumbs up so that YouTube could send my videos out to like-minded viewers just like you. 2. I've noticed that 70% of you who have revisited this channel have not yet subscribed. Please hit that subscribe button. That way my channel will grow. And my promise to you is to give you more content with substance just like these. Do we have a deal? Thank you. All right, most righteous and eternal Father, we just ask that you may forgive us of our sins, and as we gathered here to share some valid information about fibromyalgia, we pray that you may give us the understanding so that we can understand. I pray that you may bless those who will be joining in on TikTok, those who will be watching us from YouTube. We pray that you may bless the speaker, my guest, that you may continue to give her words of wisdom. In your name I pray. Amen. All right. So last time we were here, we talked about fibromyalgia and the symptoms. And you dive into some very interesting feed where you spoke about the muscles and breathing. And this week we're going to be talking about a little bit more about the healing process and a few things. But I went on your website and I see a lot of information that I think will be valuable to the public. So before we get into your healing method, I would like to touch a bit on those that I've seen. And the first thing I would like to speak about is costochondritis.
Yeah, costochondritis, yeah.
Can you tell us what is costochondritis, please?
Well, costochondritis is the label that is given to pain in your costal regions. I mean, your costochondria basically means your rib cartilage. As your ribs come round from your back, they're bone, and then it turns into cartilage at the front. So it's pain there. They say pain and inflammation. In the medical world, anything ending in itis is said to be an inflammation, but it's pain here, and it's where the rib cartilage comes round, and because cartilage is softer than bone, if there's any tensions and restrictions in the abdominal muscles, if posture is bad, if you're tilted forward, it starts to pull on the rib cartilage, and it causes pain, tensions, and it can be a very intense pain. When people first get it, they often end up at hospital thinking they're having a heart attack. It can be very sharp, it can be crushing pains. So technically, costochondritis is that area there, but the pain's also spread around the ribs, around the back, wraparound pain. Because a lot of people try to break down their symptoms into areas, but so much is connected. And where does one pain start, another pain stop? But costochondritis itself is the front bit. Back. Don't know if you can see this clearly, but where these muscles attach here, your ribs lie underneath, and it's pulling here, bad postures, tensions, and that basically, I believe, is the origins of the costochondritis pain. It's physical tensions on that area that's generating tensions. It hurts. We shouldn't be in that position.
So you said that in the medical field, anything with itis is inflammation.
That is the theory with naming things. Yes, like, tonsillitis. Your tonsils are inflamed. Gastritis, gastro is stomach. Your stomach is inflamed. Arthritis, arthro means joints, so joint inflammation. That's how the medical terminology works. Whether there's an active inflammation there or not, it depends on what level you look, because inflammation is a massive topic, and it's far too complicated to go into. But the signs of an active inflammation, they say heat, pain, tenderness, swelling, redness. If you've got a cut on your hand, you see all those things, or an active twist. But then the inflammation can also happen on a much lower level. There's very little to see on the outside, but something is generating the pain signals. There's some tension, there's stress there. So that's, yeah, how much of it is active inflammation? Because, for instance, fibromyalgia, the whole picture, a lot of the medical profession say there is no evidence of inflammation. And yet costochondritis, the doctor will turn around and say to you, you've got inflammation there. So there's a lot of bad terminology and misnaming going on. But the pain is there, the tensions are there due to bad postures, pulling.
Okay. Because for me, when you mentioned that just now, about itis, it draws something to my attention. Because when you go to the doctor, for instance, for arthritis,
Yeah.
they don't give you any form of medication or even tell you what to do to clear those inflammation. They probably give you some painkillers, but
well, that's an interesting thing, because a lot of the painkillers, things like the ibuprofen, naproxen, they are actually called non-steroidal anti-inflammatory drugs.
yeah.
Because within the body, everything causes inflammation to some extent. What we eat, the air we breathe, something in the tissues. Now, in the body, the natural anti-inflammatory are called corticosteroids. And then the medical profession have come up with what they call non-steroidals. So you've either got steroids or non-steroidal anti-inflammatory drugs. They're normally called NSAIDs, NSAID, but that is the group that things like ibuprofen and naproxen fall into. So technically the painkillers are actually anti-inflammatory painkillers, if that makes sense, as opposed to things like opiates, which actually block pain receptors. So it's a different class of drugs with the painkillers. Some are anti-inflammatories, because if you've got swelling somewhere and it's inflamed, that swelling causes tension, that causes pain. So reducing the inflammation reduces the pain signals.
Right. Okay. Because I always thought, like, I know about ibuprofen. I can't never call that words. But I know that is an anti-inflammatory
Yes.
painkiller.
And that's how it works in its pain killing action. It's reducing any inflammation. It's blocking the inflammation pathway. You know, there's something that reacts with something, with something, with something, with something, until you get this reaction. The steroids, the corticosteroids, tend to block high up in the pathway. The anti-inflammatory non-steroidals tend to block lower, and in fact they tend to split them into COX-1 and COX-2 inhibitors, which part of the pathway they block. If you block one part of the pathway, you get more side effects, which is why, you know, the gut ulceration, kidneys, liver, things can be affected, whereas the COX-2 tend to be a bit more specific with the pain anti-inflammatory. But it's very complicated. There's lots going on with inflammation and trying to stop inflammation within the body.
Okay. On your website, you break down fibromyalgia into 3 categories. Yeah, carry on.
Well, it's more for the definition, because you've got the word fibromyalgia. Now you've got the fibro bit. Fibro means fibers, and that's talking about your connective tissue fibers, mostly collagen. I mean, throughout the body, I mean, all these strips, the white strips, are connective tissue. I mean, your bones are connective tissue, but they've just got a lot of calcium laid into them, so they're solid. Your tendons and ligaments are a lot of collagen fibers, very close together, tight, sticky. And then you've got fluffy connective tissues that are lots of loose fibers. So it's throughout the body, there's all these fibers. As I say, depending on how they're arranged and how dense they are, gives you the type of connective tissue. So you've got your bones, lots of calcium that turns into cartilage, which is the solid connective tissue, but there isn't the calcium in it, so it's bendier, and then it gets softer. But for instance, every muscle, you've got thousands of muscle cells. Every single cell has a wrapping of connective tissue around it. And then there's cells in bundles. The muscle cells are also called muscle fibers. It gets very confusing when there's multiple terms for the same thing. But a muscle cell, a muscle fiber, is wrapped in connective tissue. And then these bundles of muscle cells are then wrapped in more connective tissue. And then the whole muscle has another layer of connective tissue. And that will all fuse to go into a tendon that starts to attach to a bone, but merging with the periosteum, which is the connective tissue that wraps round the bone. So there's just this flow throughout the body. Myofascial meridians are actually a very good demonstration of this, where you can sort of get the strips, you get muscles within them, you know, attaching to bones and moving throughout the body. But that's the fibro part.
Right.
And then you have the myo. Now myo means muscle, and that's so the muscles within it. And then algia comes from algos, which means pains. So it literally means connective tissue and muscle pain, the fibromyalgia label.
Okay, that makes sense. That makes sense. Stored trauma. What is that? How's that link with fibromyalgia?
A lot of people use the definition of stored trauma, and a lot of people tend to think of it as emotional and mental, but they're forgetting the physical aspect of our bodies. For instance, if you fall down, you slip, you bang, there's like a micro shock that will go through your body, you know, that jerking. Now, if that is causing a little bit of inflammation in that position, the connective tissues, because one thing that inflammation does is it causes connective tissues to get a bit stickier. Okay. I mean, things like when a wound's healing or surgical adhesions are very good examples, but you're getting an imprint of the damage, and that is the stored trauma. The inflammation effects on your body. You know, if you twist your ankle, it doesn't necessarily get better. A lot of people will carry around these little niggles and things that they've never really healed from. That to me is a stored trauma. The body's been traumatized physically, and there's a record of it within the connective tissues that have put us off balance, twisted, restricted, that the physical stored trauma on your body. That makes sense.
Someone commented that she's been suffering with fibromyalgia for 10 years.
So it's a chronic condition because nobody seems to be looking at the whole of the body, the condition of the whole of the body. I mean, there's lots of research that's going in for brain scans and blood tests and things, but examining the physical condition, for instance, a whiplash injury to the neck, a jerk forward, you've got micro tears in your neck. Now, your head should move forward, backward, side, side. There's a lot of movement there, but if you have a little bit of damage and it gets stuck in one position slightly, you can still avoid it. You can avoid that position. It's painful. So you naturally avoid it, and you've got a million other options. But as the body gets stiffer and stiffer, everything gets more restricted, tighter, more pain, more weird sensations, and it's a cumulative damage. For every injury you have, if you don't fully heal from it, you're storing it, you're absorbing it. It puts your body more and more off balance.
So while
but yeah, a whiplash injury is a very good thing, because then it affects the whole of, you can have shock waves through the whole of your body because there's tensions up in your neck.
So while the body is getting stiffer, or the muscle is getting stiffer, is that inflammation?
The inflammation does that. As I say, the inflammation has the effect of making these collagen fibers cross-link. They get a bit sticky, they get a bit more restricted, a little bit of tension. For instance, my knees are particularly bad at the moment, and that's the thing I've had from a small child, because anything can cause inflammation. It can be a trauma, surgery, even just being immobile. If you've been sitting for hours in a bad position, if your body's been under a little bit of stress, it causes a bit of inflammation, it causes a little bit of stiffness. And the more you get, the more symptoms you have.
I've learned that inflammation can be also a part of the healing process.
Yes. Well, inflammation is our natural way of healing. It's making the tissues react to let them heal. But if you don't, as I say, because if you've twisted your ankle, you get the inflammation to immobilize it, to give it the chance to heal. But that, you then need to stretch through it and release those tissues afterwards, which is why the benefits of movement, but moving with the right muscles, is the way forward. So inflammation is good when it's helping us, but it does have negative effects when we need to work through them.
Okay. Fibro fog, what is that?
Fibro fog, well, that's what people describe for the cognitive effects that affect your thinking. That it makes it harder to think. For me, my body is constantly sending me signals saying it's in pain. I mean, for now, I'm going to stick my hot water bottle down my back. It'll be easier. Trying to find a position to be uncomfortable in. But yeah, my body is sending signals saying you're in pain. I can ignore a lot of that, but it does get difficult. It does take a lot of brain power to be ignoring that. So that's one of the causes of fibro fog. Now, if you're in a lot of pain, you don't tend to sleep well. It's hard to get comfortable. You're not sleeping well. It makes it harder to think. If you're relying, a lot of people unfortunately have to rely on caffeine and stimulants to try and keep going during the day, which makes it harder to sleep at night. It's a vicious circle. A lot of the medications prescribed for fibromyalgia can actually make you a bit dozy as well. So that adds to the effects of fibro fog. But basically struggling to come up with a word, to remember what you were doing, getting distracted, just struggling to function as well as you think you should. But I also think a certain cohort of fibromyalgia sufferers tend to be high achievers. They're pushing through, they expect the best, and then, you know, they get stressed when can't do things quite as well. I'm desperate to go and look at my piece of paper with my fibro fog written on it now. Let me just I'll see for a second. So I think I covered most of it. But yeah, pain signals from your body. You're getting anxiety, stress because you have this pain. It's hard to think. Your mind won't shut off because of all these signals. The sleep, you're exhausted, various things. Also, I mean, diet, mineral deficiencies, everything, you know, you need to look at. But medication. So yeah, just struggling to think.
So and that is all through fibromyalgia.
It's a part of
The part of the
with the
symptom.
chronic pain. Yeah, the chronic pain feeding to your brain. So yes, the fibromyalgia, the pains from the body, it's just too much information for your brain to cope with. And then trying to deal with other things, especially surprises. I'm better if I expect a conversation, whereas, you know, a question out of the blue, you know, I might just have this blank, almost feeling that there's no brain function for a minute. It's quite a weird thing, actually. You just, and then things need to catch up. Or if I'm in a lot of pain, particularly bad pain, it's hard to move from blocking that pain to focusing on something else. So that is my explanation for a lot of the brain fog associated with fibromyalgia.
I see also on the website about baseline movement. You have the 5 main muscle of movement. Can you break down that for us?
Well, that's, I mean, so much ignoring of the physical, and when you actually look at how we're put together, the muscles we all share and how our body is connected. For instance, back pain, very common. But if we focus on the muscle at the front, connecting pelvis to chest, if that is long and strong, that is taking all the pressure off the back, all the muscles that go wrong, because our spine is designed to protect our spinal cord. It's not a stack of blocks that keep us upright. It's our muscles and our connective tissues that keep us upright. So using the right muscles. So midline, rectus abdominis, section by section, pelvis to chest. Pelvic floor provides a lot of sensory feedback about the position of our body. So being aware of our pelvic floor muscles gives the feedback for our sense of proprioception, our sense of position, movement, and balance. Gives the feedback a base position in our brain to then start to work from for the position of the rest of the body. So your pelvic floor base, your rectus abdominis line, and that's where the baseline comes from. The key muscles to start connecting body and mind, to start giving us a reference for the position of the rest of our bodies. Now at the front, we've got from hip, from shin, there's a bump on the front of your shin, up kneecap, that goes up to your hips. Now that is called your rectus femoris. It means upright femur, the bone there. But that should be a long, strong pole from shin to hip. And that gives you the position of the front of your leg. And then you have your gluteus maximus, which is your biggest muscles in your body, powerhouse muscles that sit at the back of your pelvis. But they also attach to the back of your femur. So between your rectus femoris here and your gluteus maximus, you're positioning your leg to your torso correctly. And then as those muscles move, it's holding your leg in relative alignment, whatever position it's in. And then for your upper body, I don't know, doesn't show up very well on this suit, but you have a muscle that comes from your mid-back all the way up to the back of your neck, shoulder to shoulder. Now that's the trapezius muscles. It's like a blanket of muscle. Take my water bottle out. So all the way up there, up there. Now, being aware of the positioning of that muscle, because it's the most superficial muscle, and if that can spread, it means all the muscles underneath are also in the right position. And connecting with that muscle, thinking about, it's not about strength with this, it's about feeling the full range of movement. But focusing on those 5 main muscles gives you the central reference for the position of the rest of your body, especially, as I say, breathing with your baseline, feeling that central connection, and then letting yourself move. I'm very twisted as I sit here. But yeah, that's the 5 main muscles. Key anatomy to understand, to feel, to find on your body, to be aware of, and then feeling where you're imbalanced, where you're twisted, restricted, where the tensions are.
So then it's good to, when we are exercising, to work on our core muscle.
Yes, your core pillar of strength, your rectus abdominis, as I say, your gluteus maximus gives you that stability at the back of your pelvis, and your rectus femoris gives you the positioning at the front of your body. As for instance, your knees will extend and flex. They don't have much rotation movement. So if there's a little bit of a misalignment, you start to get knee pains. There's tensions within the connective tissues around the knees, pulling. Could be twinges in one way, it could feel like a whole band, but it's a misalignment that's causing stress, tension, pain, inflammation. So that vicious circle of not being quite in the right position, causing a little bit of tension. You avoid pain, so you might move, but if you're moving in the wrong direction and getting more twisted, you're just making it worse. Whereas you take a deep breath, stretch up, feel in which direction to move to make an improvement.
Someone just commented about her being in with this fibromyalgia for over 10 years. And you have some method that you use to really manage your symptoms or to put you in a better position. Can you share with us, like, what are some of these healing mechanisms that you use to help yourself with your fibromyalgia?
Well, understanding the 5 main muscles and also the anatomy of alignment, feeling your midline and back of your neck. So increasing your body awareness, and that comes with breathing. I mean, everything, everything we work with in a positive thing starts with breathing. But starting to take a deep breath, thinking of these muscles activating section by section. So I'll sort of breathe, I'll think of here and then here. I tend to breathe in through my nose, out through my mouth as a tension release, but in and extend. I mean, as I did that, I could feel something in the back of my pelvis releasing. But as I stretch, I can feel a tension. I try and breathe, try and extend, try and let that tension release. So as my core pillar of strength here supports the rest of my body, it then allows the tenser areas to release. Now, it's been a very long, slow process. I started this in 2017 and I'm still in a lot of pain, but infinitely better than I was. But yeah, my shoulders, then thinking from here, extending, and then my trapezius muscles from my mid back, like wings spreading. I mean, it took a few weeks for me to even be able to activate those muscles, and I'm still very squint now. But thinking of where things should be, being aware, just moving, twisting, letting the crunches and cracks happen. You never force anything and only ever do what feels right, but it does feel right because I have this connection between body and brain now that I can feel where my bits should be, or sometimes more aware of which direction to move in to make improvements. So, I mean, lots of things I use to help me. I mean, the hot water bottle, I find heat helps. I spend a lot of time in a swimming pool using floats. I've got a good swimming pool I go to. It's not deep, so you can walk in it. I can use the floats to feel the balance in my arms, to try and let the rest of my body just relax, gives me the freedom to move. I'm a great believer in exercise in water, actually, because you've got some resistance, but you've also got the support. So it's very much easier on your body to move. Also, my therapy, spiky balls, massage, manual therapies are great if you can find a good practitioner, whether it be a chiropractor or an osteopath. I've had people who had very good results with cupping, with heat. I haven't tried it personally, but anything that was releasing those restrictions within the tissues, allowing you to move, allowing you to realign a little bit more will help.
So have you done any exercise? Like what kind of exercise routine that you have done? Apart
I mean, I've had all sorts of things over the years, but things I would recommend to start with is actually a very basic Pilates class, or anything that works on your breathing, starting from here and extending out. I do yoga a couple of times a week now, but I mean, I went to a class this morning and I'm listening, but I'm not really doing the moves because I can't, but I'm moving in the right direction. So anything working from your baseline will help. Tai Chi is another example of range of movement. I don't have the patience for Tai Chi. It's too slow for me. So between being in water, listening in a yoga class, but doing my own moves, because I can't hold a pose, I can't twist, I have to keep shuffling to release the tissues. But Pilates, in fact, I don't know if you know anything about Joseph Pilates, the guy that came up with Pilates, but he was a very sick man. I think he had severe fibromyalgia, but he developed these exercises and he recovered. Now, classic Pilates is actually very hard on the body, the way it's described, but finding a nice Pilates class where you can lie on the floor, you can start to do the moves, but again, just being aware of your midline and working with the 5 main muscles and doing what feels right for you, not worrying about what anybody else can do, because a lot of the fight, if you've had a fairly pain-free life and you've started getting the early signs of fibromyalgia, you've probably not got a lot of stored trauma on your body. You're not that far away from being free to move. Whereas for people like me that have had fibromyalgia all their life and have done a lot of damage, getting out of bed is hard work. So Pilates will also be hard work, but just staying at the lowest levels, just thinking of the muscles that you should be using, shifting, fidgeting, getting yourself into a better position, letting the releases happen. And I mean, the releases can be, I'll feel the physical clicks, but also sometimes the emotional releases. I mean, I will have a quick cry in a yoga class now. I'll have done a stretch, there's a release, I'll have a quick sob, a couple of deep breaths and get on with it again, because it's the crying, screaming, sobbing, anything, again, taking a deep breath is releasing tissues, it's stretching. So yes, the physical releasing, the emotional releasing.
You said Pilates. That
Yes.
um get recover or recovery through his method. So
I
there's hope for people like you and for those who are struggling with fibromyalgia then.
Yes, definitely. I mean, I was a depressed wreck. What was it, 2016? I could barely move. I hated myself. I hated the world. I hated everything. I had no hope of ever feeling better. The pain had been with me for so long, but I'd also been depressed for 17 years. And I hadn't associated the depression with my pain. And it was only when a layer of tension released from my body, I suddenly felt a bit better, and something clicked. Just the awareness of how bad my body was, because also actually realizing the acknowledgement of my physical condition was wrecked. I mean, I'd fought through, I'd had a very physical job. I'd always been in pain, but I'd always carried on, but doing more and more damage. But realizing where the pain is coming from has helped my healing. You know, understanding why I'm in pain at this point, why this is now sore, and, you know, shifting, moving. Because often, I mean, the thing with fibromyalgia is you've got so many pains everywhere. You know, if somebody asks you, how are you today, you know, or how's your shoulder, you think, oh, well, that was 3 days ago, I'm now on to something else. It made me feel crazy. Was I making it up? I tell a story of, I was in the kitchen on my own, and I picked up a frying pan, and I found myself screaming in pain. And I felt like such a drama queen, but, you know, I had no audience. There was no one watching. It was actual physical pain.
Just by lifting
But
up,
sorry?
just by lifting up the pan.
Yes. Yeah. It's like wrong position, the pain, and the pain was real, but I felt like I was making it up, but it wasn't. It's real. And I think, I'm fairly convinced, the origins of the hypochondriac label, because your hypo means below, chondria, like your costochondritis, is here. The tension's pain here, and you get feelings all over. But if a doctor looks at you, they couldn't see anything, and you're back next week with another problem. And this, because the pain spreads, it shifts around, it moves. And if the medical profession don't believe you, or you start to think, how can I have all these symptoms and syndromes? I mean, so many muscle syndromes that go wrong. And I'm thinking, I've got all of them. And I'm thinking, how can I have all of them? But I did, because my physical condition was that bad. And being hypermobile makes it easier to get into worse postures, to increase the stress, to do more damage.
So that means there is no operation to correct any fibromyalgia then.
No,
Because
no.
if the symptoms move from here to there, that means there could never be an operation.
There's nothing to operate on to fix. You have a myalgia of imbalance. If you're not using the right muscles, you're using the wrong muscles. And as muscles get sore, you avoid the pain. So you twist around, you use another muscle. You know, for instance, you know, it might be a little bit sore here, but I move to avoid that pain, but then that puts tension here. I move here. And then you have an injury on top of that, which puts you in a bad position. You move around. So the pain spreads up and down. So yeah, it's a whole body problem, the fibromyalgia.
How do you become so knowledgeable about fibromyalgia?
My healing journey. I mean, I've been in pain all of my life. I mean, and from 7, 8 years old, playing with the models in the orthopedic consultants office. I've always been fascinated with anatomy and how we're put together. And I think it's just making the connections. I was so bad. As I've healed, just so much has been obvious to me now. Obviously, being a veterinary surgeon, I've had training, you know, you do anatomy of all the animals. Doing human anatomy on top isn't really any extra. And I know what we're like inside. Dogs, cats, horses, we're all the same, you know, what we're made of, the way the tissues react. And to be honest, it all just seems so obvious to me now. And basic anatomy, facts, logic, where the pain is coming from. So I think personal experience, education. I've done a lot of research over the decades into pain and conditions. So I've absorbed a lot of knowledge. I've always tried to be open to different perspectives and explanations. And there's so much. I mean, for instance, like traditional Chinese medicine explains a lot but because they didn't have the knowledge of the chemicals within the body, they've used stories to make connections. You know, when they talk about water and kidneys and it affects the lungs and then affects your bones, well, there's a hormone that's made in your kidneys, it's transformed in your lungs, it affects the bone marrow. There's so many connections within the body. It's how we explain it, what stories we use to explain these connections. The connections are there, it's just how we look upon it. And I look upon it in a very sort of scientific, anatomical, using the physical to explain what's going on with the fibromyalgia.
What are you looking to gain from, what are you looking to achieve from this whole thing by, you know, spreading?
Helping getting people to think about where their pain is from, to take some deep breaths, to start to build the connection to so many people are in pain. Especially as people get older, the more bits and pieces, and just to be able to use bodies better, to understand. And my foot's spasming. Ow. But yeah, to help people feel better, to not be in so much pain.
Do sleeping, while sleeping, does it have any effect on your body?
As in,
Position.
sorry.
To lay into a certain position, does it have any effect on your body?
If you're in a position that stresses your body, it causes. I mean, you get inflammation with immobility.
Mhm.
Um, it's very hard to sleep when you're in pain, and trying to find a good position to sleep in is difficult. I mean, I got various pillows, like for instance, my arm, so my arm doesn't collapse. I will have a pillow under my arm that helps. Finding a good position, moving around. I mean, I sometimes have these under my shoulder blades. I mean, people think they're actually very painful, but I find it's a bit of more of a controlled pain rather than the actual pain I'm in. It's helping me stretch. So the heat, trying to get the hot water bottle. By the time I go to bed at night here, I mean, it's aching now, but I'm normally very sore here. So I'll have my hot water bottle here. I'll try and stretch. I have these in my hands, so I'm actually aware of where my hands are because I'm so tense in my upper body. The proprioceptive feedback about where the position of my body is blocked. So this helps me figure out where my hands are, so I can then help move my arms into a better position to stretch. A lot of fidgeting, but again, the breathing, the connecting with your core pillar of strength to feel how to move. Sometimes I've slept. I mean, sometimes I'll sleep on the floor because I want a hard surface. Sometimes I'll bunch up my duvet so I'm sleeping more upright. Just finding position where there's the least amount of stress and then letting myself move.
Would you consider it a pain, like, what would I say? Like on a day-to-day life, your day-to-day struggle. Is it struggling for you on a day-to-day basis? That's what I'm trying to
Constantly.
constantly.
There's always a pain there from waking up, an early morning stiffness, trying to work through it, trying to get a little bit of movement before I get out of bed. For instance, my knees have been quite bad the last few weeks. So I'll go down and have a cup of tea, trying to get back up the stairs. My knees are very stiff. I have to stop, breathe, do some stretching, releasing. So yeah, and a daily cycle of pain as it moves around. As I say, this bit, my back is very bad at the moment. It's quite distracting. That will ease off in a couple of hours. My shoulders were particularly bad this morning. It's whichever tissues are restricted under the most stress at the time, whichever posture you're in is generating pain. So constant pain.
What would be your encouragement to those who are struggling with fibromyalgia?
It can be greatly improved. You have to be the one to make that decision, though, to take the deep breaths, to think about where your pain is coming from, to connect. Healing hurts. For every pain and stored trauma on your body, you do have to release it, or you have to relive it to release it. As I say, my knees have been bad since a child, and I'm back to that pain, the early pains of being at school and sitting on the carpet getting read a story. I remember these pains now, or playing the games, running up and down. And as I say, the pain was always there. I didn't think it was abnormal. So reliving, releasing, working through the layers of tension. But yes, massive improvements in me. I think so many more of us could be better. The breathing, thinking of your midline, finding practical ways to help yourself. Things, if it appeals to you, try it. If you think, oh, that's not for me, then yeah, don't do anything you don't want to do. But everything from a head massage to a foot massage to going for a physiotherapy session, well, a manual therapy session. Get in a pool if you can, warm water. You know, I used to love showers, the hot water. I wouldn't have the energy to actually stand up in the shower. I would always, as a teenager, I would always sit in the shower. But I loved the hot water because it's something on my back. It felt nice. So do what feels right for you, but follow me. Watch my videos, but yeah, read my website. The anatomy is there. Understand where the pain is coming from. Because I mean, fibromyalgia, either doctors don't believe you, or you're dismissed, or you're told. I mean, somebody is saying that they've been told that their pain is due to their anxiety and depression. Well, actually, your depression and your anxiety are probably due to your pain. So trust yourself. The pain is real. Your muscles, your connective tissues are generating these pain signals telling you there's something wrong. It's just a matter of correcting this, which takes time, which takes effort. But go easy on yourself. It's not your fault. You just need to learn when to move, when to rest.
But what if they say that the pain is so intense, they don't have any motivation to do anything?
Then at that point, go and curl up on a sofa, breathe. I mean, you've got to breathe anyway. So think of your midline, and just, even if it's just wiggling your toes or, you know, moving your hands, it's some movement. I mean, I can feel my wrists, you know, a bit of a release there. I mean, every movement counts. The more stored trauma on your body, the more twisted and restricted you are, the harder it will be. But take a deep breath, stretch out, let yourself move, let yourself cry, let yourself scream if you can scream. I mean, the physical tensions here, I couldn't scream for a very long time. I used to wake up with nightmares trying to, you know, but there was nothing that would come out because everything was so tense here. But slowly over time, being able to cry and then being able to scream into a pillow, to just stretch, release. But it does take time. It does take effort. But once you, I started healing in January 2017. It was about 2.5, 3 months when I made this connection that I started to feel better, that I realized that I could recover, that where all the pain was coming from. So since then, the healing's been a lot easier. I mean, a lot of pain. I've, you know, curled up in a ball on the floor for 3-4 hours a night with a hot water bottle over like the costochondritis pain. So it's not easy, but I mean, what is your choice? Because the pain will stay with you unless you decide to work through it and release it, to use your body better, to improve your posture, to release the physical restrictions. But well, I mean, you wouldn't have caught me on social media a year ago, never mind doing a podcast. So yeah, every day better.
Well, Leigh, I appreciate this podcast again. And I hope you find complete healing through your method. And I hope people can, listen to you and be encouraged and
There
search
is hope.
site and
Yeah.
find
I
some information on it, because there's a lot of information on your website. And I would encourage people to go there. And as I said, your website would be linked in my description, so people can just click on the link and it would take them straight to your website. And also you have a TikTok page that will be linked as well. So I thank you once again. And we still have more to discuss. But further on, we will have that agreement and take it from there.
Yeah, we'll sort stuff out. Well, thank you for doing this as well. It's amazing what you do, trying to share the knowledge and help people,
Yeah.
because there's so much misinformation out there. I hope just trying to explain, but always think for yourself, question everything. But the basic anatomy, the facts, it's all there. So in your own time, I'm a great believer in things happening in the right time, but taking a deep breath, relaxing as much as you can. So thank you.
Thank you again. Take care.
Cheers.
Bye. Today I wanted to finally tell you guys how I get rid of my acid reflux without no medication. All right? But please note that this is not a medical advice. Especially if you are already on medication, you would want to consult your doctor before applying any of these methods onto yourself, because not every medication react well with these methods that I'm about to give to you. And two simple things that I have used that is in my cupboard, that probably in your cupboard, that could help you relieve your symptoms of acid reflux without any medication.